And in vitro model even, they simply use this belladonna 6C, which was inoculated in chorioallantoic membrane. And if you can see, this is a pre-treated uh, right side, the pre-treated membrane, and then this was the untreated membrane. And you can see this is the virus control. There's a pock marks which have appeared here. And if you can see there, when they were pre-treated with belladonna 6, the pock marks was there was no growth of virus there on this cell membrane. It inhibited the growth of those viruses. And then we wanted to further confirm it that on in vivo model. And Dr. Bhaspati Bandyopadhyay from the Institute of Virological Diseases in West Bengal, Kolkata. This is a good study which was published in International Journal of Microbiological Research, where they took up these three groups of control group suckling mice whose mothers were not fed with belladonna 200. Then there was an experimental group 1, suckling mice whose mothers were fed with a belladonna 200 for 7 days, then belladonna 200 for 14 days. The average survival rate of the control group, where mothers was not treated with the medicine, was 47.92%. In the experimental group, it was the suckling mice where mothers were treated with belladonna 200 for 7 days was 80.60%. The rate in the experimental group of suckling mice where mothers were treated with the medicine for 14 days was 79.24%. So almost equal effect at 7 days or 14 days dose. And there was no significant difference between the two groups of experimental group. But there was major significant difference between the control and experiment group. This is just mice which actually protected, they were protected up to 28 days by this belladonna 200 potency. Another experiment was taken up using the homeopathic medicine Berberis vulgaris. It's a well-known drug for rhinolithiasis, nephrolithiasis actually. So this medicine was used on animal model to see whether this prevents formation of stone in the renal tissue, and that wise the study was attempted to evaluate the extent of oxidative stress in experimental urolithiasis by measuring some parameters of oxidant stress and antioxidant defenses in rat kidneys. A rat model of urolithiasis was established by administering ethyl glycol in drinking water and the effects of homeopathic preparation of Berberis vulgaris root bark on the renal antioxidative defense system as well as on potent markers of the free radical activities were investigated. I just give you a graphical representation of the renal tissue here, the histopathological observations. The left side top one is a normal rat kidney section, and in the right side is the hypoauxillaric rat kidney after they were fed with ethyl glycol, ethylene glycol. And if you the left side down below with the pink slide, if you can see the ethyl glycol which are pre-treated with Berberis vulgaris 200, and you can see here that there was no deposition of calcium oxalates in the renal tissue here. And if they were treated on the normal rats who were not fed with ethyl glycol, with only Berberis vulgaris 200, there was no damage to the rat kidney section, and we could demonstrate that through these experiments. She has further taken up now on the pathways, actually, how these medicines are working now in these renal tissues and preventing this stone formation. Another 3 studies were taken up on cancer model at Bose Institute, which is a premier institute for basic research studies in West Bengal. And this they could demonstrate that Calcarea carb induces apoptosis in cancer cells in p53 dependent manner. Although before this they had done all kind of screening using different kind of cell lines with homeopathic medicines and animal models, and then they reached to the pathway of action of these homeopathic medicine, and they could demonstrate that calcarea carb actually induces apoptosis in cancer cells in p53 dependent manner via an immunomodulatory circuit. And the results indicated a two-step mechanism actually of the induction of apoptosis in tumor cells by calcarea carb. That is activation of the immune system of the host and induction of cancer cell apoptosis via immunomodulatory circuit in p53 dependent manner by down-regulating BCL PAX ratio. And this has actually resulted in mitochondrial transmembrane potential loss and cytochrome C release. And knocking out of p53 by RNA interference inhibited actually the calcarea carb induced apoptosis, thereby confirming there's a contribution of p53 in the apoptosis by calcarea carb. This was another study we wanted to see that again with using Thuja, and Thuja actually took up a different kind of a pathway in memory epithelial carcinoma cells, where they demonstrated highlighting the imperative role of reactive oxygen species in initiating and amplifying the p53 dependent programmed suicide of breast cancer cells. And similarly, in a third experiment, they use actually uh, silicea also, and it had a different pathway and sulfur also. Now, symphytum officinale is a very well-known in homeopathic parlance for bone reunion, and that's why we also wanted to see whether how this osteogenesis coming up and through laboratory models, and we use this symphytum officinale, and this was taken up in All India Institute of Medical Science in Delhi in a stem cell department, and they could demonstrate that symphytum officinale actually augments osteogenesis in human bone marrow derived mesenchymal stem cells in vitro as they differentiate into osteoblasts. And this has been now, this is now a published research findings of our study where we could demonstrate how this osteogenesis is coming up and through a osteoclastic differentiation from osteogenic differentiation from stem cells to the bone cells. And then we have a osteoblastic differentiation of these are the basically the mesenchymal stem cells for 2 weeks or post-interventional symphytum motion. The maximum results have been seen in mother tincture form, and if you see here, this is basically the BDM plus mother tincture, where the maximum number of osteoclastic differentiation you can see here in the slides. Although there was a significant osteoclastic differentiation with 6C also as compared to, but it was more observed using symphytum officinale mother tincture. Coming to the last part of my presentation, that is about the nanocurcumin, a homeopathic formulation, which is a turmeric-based homeopathic medicine, which this a special nanocurcumin has been prepared by one of the scientists, Dr. Santokh Kar, and we use homeopathic formulation as a therapeutic intervention, which prevents blood-brain barrier damage and improves survival of Plasmodium burgii, ANCA-infected mice. If you can see here, there was a specific 4 groups where is infected or untreated, and then nanocurcumin 30C, infected potentized ethyl alcohol, treated also. So we use this as a another control as ethyl alcohol, whereas there might be a potentized ethyl alcohol might be bringing that kind of effect. If you can see that this is the uninfected, the left side, first the brain which was of the uninfected mice, then infected, untreated. This was totally damaged because of this infection of Plasmodium burgii, and similarly, this was infected potentized of again with a Plasmodium burgii. But if you have given them a pre-treated with a nanocurcumin 30C, there was total protection of the brain, which we have seen here in this particular study. So this kind of experiments have now given a strong evidence that it's not simple placebo. These are specific homeopathic medicines having a specific biological actions in terms of laboratory experiments. And this is how the three histopathological slides of these three organs, brain, spleen, and liver. If you see the uninfected, if you see the three topmost layer, and then to the nanocurcumin 30C treated at the bottom three. These are all three organs have been protected with the nanocurcumin 30C in a plasmon Burkey Ankai mice. So there is some evidence on the plausibility about homeopathy. It's not implausible. More evidence required to make it acceptable, I know, and we have worked in three areas now. Potentization, is it a demonstrable reality? Yes, we have proved that potentized homeopathic medicines have nanoparticles. These nanoparticles are actually there even in 200 potency. And we have gone into some kind of a pathway of actions of homeopathic medicines through these cancer model, cancer cell line studies, where we have seen apoptosis coming up through a different kind of a pathways by these three different medicines. We have come out somewhat understanding on what is the nature of homeopathic medicine in potentized form, and can homeopathic medicine in potencies beyond avogadro number have biological effect, and these biological effects are now very well documented in our preclinical models at different levels. However, we have to still work on more on these areas, and we like to go on continuing taking up such experiments in our council. Thank you so much for giving me an opportunity to talk.
Thank you very much for this wonderful lecture. We have now a bit an issue with Carla how to manage the questions, because some will be in Portuguese. So I think Carla will manage the question and answer section. I think people are still typing. So if you have a question, please write it into the chat. And in this time, I would like to ask Dr. Manchanda. It is a question related to the situation of homeopathy in Europe. You know, Hahnemann actually developed homeopathy in Europe, and strangely, actually, the situation here is very difficult. And when I hear such wonderful news from India, as also from Brazil, from the countries where homeopathy is used in the medical system, I wanted to ask you if you would have some kind of advice to the politicians here in our country, or what would you do on their position, in their place, to make this situation here better?
What we have seen, that homeopathy has always been a people's movement. And in Europe, somehow for the last about 2 decades, a negative narrative is being fed to the politician regularly against homeopathy. Somewhere we need to correct that narrative. And one of the way is integrate homeopathy in the respective traditional systems in every country. Because homeopathy is a global science. It has presence in almost all countries, though it was originated in Germany, spread in Europe, and then in the United States, and then there was a downfall. But somehow, what I feel that European community, especially community of homeopath, has to take a lead in convincing politicians about the virtues of homeopathy. They have to showcase case studies of Brazil, they have to showcase some case studies of Mexico, from India, and from different regions. This was one of the primary reasons that we tried to start talking in terms of memorandum of association, MOUs with different countries, with different universities. But somehow the response was not, from other side, was not that much proactive. So despite having documents, we could not move forward. So we need to convince our politicians the virtues, and the negative narrative that is prevalent in these countries needs to be addressed at all levels. This is one of the reasons that during this colloquium, we intend to discuss the strategy of integrating homeopathy within TCIM. Another very important point which I would like to make is the education system of homeopathy in Europe and in these countries. There we have restricted homeopathy to only medical doctors, and they are also being given half-hearted training of. But in Brazil, in India, we have a different education system, in several systems, where doctors are given proper training within homeopathy. So they have confidence also, they know a lot of information also, so they can convince their patients better. So we have to focus on education. Of course, in Brazil, India, we have to focus on the safeguarding our political narrative, as well as to invest in research. So these are the areas we need, everyone has to focus. On this, I discussed in one of the LMHI Congress in Leipzig few years back that we need to convince politicians and policymakers of these countries the virtues of homeopathy. That's the way. Thank you
very much. Thank you. Carla, will you manage now the other questions?
Thank you very much. It was a beautiful presentation. First question is for Dr. Manchanda. The first question is the following. Can you tell our pharmacy students here how homeopathy training is done in India? Because here in Brazil, a pharmacy student needs to go through the pharmacy course, and within this course, he can register in specific subjects of homeopathy. And at the end of the course, he or she becomes a pharmacist and also a homeopathic doctor or a homeopathic professional. In India, is it the same, or do you have a pharmacy school that is designed specifically for homeopathy?
In India, we do not have separate pharmacy education in homeopathy as developed as you have in Brazil. We have medical degree in homeopathy. And at par with conventional degree. So this is the basic difference. I several times, one of our pharmacy secretary from Brazil was Amaryllis in LMHI. And she discussed with us the lot of problems within Brazil between the medical doctors and the pharmacy students having knowledge of homeopathy. But in India, we have only medical education in homeopathy. Our pharmacy angle is not that much developed as you have developed. So here it is. Some of our pharmacy schools teach their students only somewhat about homeopathy. And homeopathic pharmacy is being taught in medical schools only. That's the difference. I hope it's okay.
Yes, perfect. We have another question for you, Dr. Manchanda. You presented several guidelines being designed by India. The Ayush government has been designing several documents related to homeopathy, training and practice, and evidence-based research. Are these guidelines accessible for everyone in the world at no cost?
Yes, all these guidelines are available on our website. I'll request my colleague, Dr. Khurana, to tell you the specific places where these are available. Anil.
See, you can visit our council's website also. This is Central Council for Research in Homeopathy. It's ccrhindia.nic.in. This is the website. I can just type it here at the chat box.
Great.
So this is our website of Central Council for Research in Homeopathy. You can see a lot of details about research and different kind of guidelines which are issued by Ministry of Ayush. And you can also have visit our Ayush Ministry guide website also. There we have different kind of it. And if you want to know more about this education side, then you now can visit our NCH, National Commission for Homeopathy website. So all regulatory aspects of homeopathic education, which is a now reconstituted, revamped now National Commission for Homeopathy, where we are now working, we are now reforming our education sector. We are bringing a lot of change in the homeopathic education side through this new commission.
This is great.
Yeah.
Excellent, and congratulations for this initiative. And I am writing down the link, and I will send information to our Congress people. Dr. Anil, we have more questions to you. I will say them in Portuguese, and you will get the translation. In the rat experiment with belladonna, what was the bacteria that caused the infection in the animals?
That was a Japanese encephalitis virus, the Nakayama strain of which causes encephalitis actually. Say Nakayama strain of Japanese encephalitis virus.
That's great, perfect. One of our delegates also has experimental results that demonstrates the effect of homeopathy in antibiotic-resistant bacteria. And the question is, do you have data on the homeopathy effects on patients that are admitted in intensive care treatment units with bacterial infections that are resistant?
Not yet. We have not worked on that area of AMR, antimicrobial resistant strains, but Dr. Manchanda has worked in one of the projects of a clinical trial where they have worked on multi-drug resistant tuberculosis. And that way they have added homeopathic medicine to the standard of care at that anti-tuberculosis treatment. And they have found good results, and that has also been published also. But now we are going to work. We have already drawn our protocols for laboratory model for antimicrobial resistance using homeopathic interventions. And we have started working on urinary tract infection, which is E. coli, the E. coli resistant strains, basically those on which we are now working on the laboratory model first. Yeah.
This is great. One more question. We observe that India uses in their experiments or trials, high potencies at 200 CH. We have been seeing this in the research outcomes. Do you have data or experiences in which you can compare the results of these high potencies with the results from low potencies? Is there a guideline at the clinic level with regards to choosing the potencies and the diseases that can be treated by homeopathy? Do you have this kind of data that you can share with us?
See, we have taken up some experiments, as I gave an example of belladonna, which has been tried in 6C, 30C, 200C. At 200C gave the best results in these mice model. However, when we go for in clinical practice, in clinical trials, these are open for the physician to prescribe according to the symptomatology. Whatever the symptomatology is there, and according to, but in our protocols, usually we start with the 6. If the patient is not responding to 6 in the research protocols, we go to 30C and 200C. And then we have many such data available in various clinical trials, where we have seen for certain disease condition, 200 has worked better for a particular medicine as compared to another medicine. Those kind of data in clinical trials are available to us. And also we have done drug provings in homeopathy in different potencies, 6C, 12C, 30C, and 200C. So even drug proving, we have seen different kind of symptomatology coming up in different potencies with the same medicine, in the same provers. So some provers are not responding to 6C, but they are responding to 200C. Means they are more sensitive to 200C and they are giving results. Similar kind of results we have seen in various experiments. In one of the experiment with Nux vomica in insomniac patients, where we have seen proving not in insomniac patients, we gave Nux vomica to the provers, they developed insomnia. And when we tried to saw the effect of homeopathic medicine Nux vomica and their cortisol levels and other enzymatic levels, like melatonin levels and other things, which are directly related with the sleep pattern. And we could find out that 200C has given a better result as compared to 6C and 30C in sleep, which is stress-induced sleep, where we have seen that cortisol levels are directly responsible for those kind of insomnia. It has brought those cortisol levels to the normal level, bringing better sleep in those provers who received actually Nux vomica 200C.
Excellent. We have several questions. Everyone is very curious and amazed at the beautiful results that India has been presenting in the field of homeopathy. And we want to express here our sincere thanks and congratulations to this amazing contribution that India has been giving us in basic research and clinical research in homeopathy. And we want to emphasize that a great deal of this data will be discussed again in the big congress of the League. And we will have more than 250 papers that have already been approved for poster. This colloquium will happen within a week, from 10 to 15 of December. So we already have the precise dates and we can let everyone know shortly. And once again, you will have the opportunity to discuss and to learn more about homeopathy with a great contribution from India with regards to this knowledge. Unfortunately, our time is getting to an end, but I want to ask the permission from Dr. Anil and Manchanda and ask you if you can send these questions that we received to your email addresses, and if you can be so kind to answer these questions to our delegates so that they can so you can answer to their specific questions, and so that we don't go over our time and we can still have our 15-minute break. and then we can conclude in a brilliant manner this opening session of our workshop with the participations with Dr. Manchanda and Dr. Khurana. Thank you very much for this first session, and we will come back in 15 minutes live.
Thank you.
Thank you very much.